genetic component.
Welcome back to the Women Factor. We are back with Dr. Fail, cardiologist at the Cardiovascular Institute of the South, and Kim Waldrup and Jeanne Caldarera, two TGMC patients who experienced heart complications. Dr. Fail, are screenings important in disease prevention?
Yes. I mean, I think that, I think there is a point in time that you have to realize that you've partied hard enough and it's probably time to go visit the doctor and figure out how much damage have you incurred, if you will. The big problem we have in screening is trying to look at the data that we obtain and try to put that person into perspective. And if you don't feel bad, if you feel good and you're exercising daily, it's hard to make you feel better, but a screening test can definitely get you sideways and start getting you in positions you really don't want to be. So really, I think the important part of screening is, where do I stand now? What are my risk factors and what do I need to work on? Don't necessarily need an angiogram, don't necessarily need open heart surgery, don't need a stent, but what do I need to work on? Do I need to work on my cholesterol? Do I need to work on my blood pressure? Do I need to work on not smoking, things like that? And that's really what screening really helps you to focus in on.
Mm-hmm. And so do you agree, I mean, obviously, that women and both men should partake in these screenings?
I think it's definitely to their advantage, yeah. I think that it really gives you an idea of, I think the screening aspect has a two-edged sword, and the problem with is the person who really doesn't want to have disease, who's partying too much, who comes in and has a negative screen, kind of leaves the arena, if you will, with, hey, I'm doing okay, I don't have to change my lifestyle, which is that's not really the answer you want to be giving. Then there are the people who are worried and say, listen, I'm a little bit concerned, and by the way, I do have a little bit of something. What do I need to work on and not to make it worse? And so it's really important that you really sit down and discuss, why are we screening? What are we doing to screen for? Because we paid our $49 and we're getting a test, or we're going to do something with that information. That information is going to be negative or positive. What are we going to do with that information? The best way to not have a heart attack is truly prevent it. And so working on your cholesterol, working on your blood pressure, working on those things, I think screening will tell you where are you on that curve, and what do you need to work harder on, what maybe can you relax a little bit on.
Mm-hmm. And say a woman having no symptoms, healthy, when should women start to see a cardiologist? Is there a specific age?
Well, that's a self-fulfilling prophecy, isn't it? Yeah, just tell all women age 20 and above to come see us. No, I mean, I think that women tend to present later. Now, there may be a lot of reasons for that. Maybe because they do present to cardiologists later, and so you start thinking, well, what's the right age group? Conventionally, it's been 55, but maybe 50 is a good age to say, let's start getting in earlier and seeing the physician earlier. You don't have to see a cardiologist. See your primary care physician. He can draw cholesterol and do your blood pressure and see where you sit. But maybe at an earlier stage, and I think women basically see their GYN, and GYNs do a very good job, and at some point in time through menopause they stop seeing the GYN as frequently, and then there's this gap between when they start seeing the cardiologist, and it's that gap we need to fill in some way, shape, or form to say, it's time to get women in earlier, maybe at age 50.
Mm-hmm. And so is heart disease something only older women should worry about?
No, not at all. I mean, I don't think a 20-year-old needs to be worried about heart disease, but I think you have to be mindful that if 1 in 3 women die of heart disease, that you have a 33% chance that in your lifetime you will develop some form of heart disease. And the best way to look at it is look at mom and dad, and if you have parents that have heart disease or struggling, it doesn't have to have a heart attack. I mean, you just hypertension and blood pressure and cholesterol rather. If they have that, that's sort of your genetic makeup, and so I think that being mindful and trying to do a healthy lifestyle early and not wait until you're 50 and say, okay, now I need to change what I'm doing, is going to be mindful of what they're doing. They don't have to come in at 20 years old to be screened, but I think it's important to at least be mindful of what's going on. And then as you get older, start thinking about screening at age 50, 55.
Mm-hmm. And so family history and genetics are crucial in detecting heart disease, correct?
They're important, and for two reasons. There's an environmental exposure, and by that I mean if your mom and dad is a meat and potatoes eater, you're a meat and potatoes eater. If your mom and dad smoke, there's a higher chance that you will smoke. If your mom and dad didn't exercise, there's a good chance you won't. If your parents were avid, marathon runners, if they were vegans, if they were vegetarians, there's a good chance that you're going to follow that lifestyle. So there's an environmental exposure to that. There's also a genetic exposure, and that's where it becomes a little bit more difficult. And so you have the 23andMe that you can get the swab and try to figure out your genetic makeup. But I don't think we're smart enough right now at this point to completely understand the full genetic exposure that happens to people. And so I think that you have to say, yes, if my dad had heart disease, or my dad had cancer, my mom had heart disease, my mom had cancer, there's a very good chance that I'm going to follow that route as their sibling, as their child. You can always change that, obviously, by trying to say, well, my dad had heart disease, but he smoked, and he was a diabetic and was overweight. So I can either follow him, or I can just say, listen, I'm going to not smoke. I'm going to make sure my blood sugar and my weight's going to be good. I'm going to exercise. And so just because your parents had it doesn't mean you have to follow it, but the genetics does play a crucial point.
Mm-hmm. And Kim and John, how has heart disease affected you both physically and emotionally? Kim?
Well, when I left the hospital originally, I was very tired, pretty pathetic, if I can use that expression. I was
Depressed.
I was depressed. I was worried. I was afraid that it was going to happen again. And when you have a heart attack or anything involving the heart, it can make you depressed. And I struggled emotionally. I really did at first. I had a hard time going to sleep at night because I had the heart attack during my sleep, and so I worried about going to sleep again because I didn't know if I would wake up. And my daughter is the one who encouraged me to start journaling about my thoughts and feelings. And so I started doing that, and then I started doing research because I wanted to understand what I was dealing with now, because I knew this was going to be, if I was going to survive, I was going to have heart disease for the rest of my life. Mm-hmm. So I wanted to know what I was facing. And I continued to write, I continued to research, and I'm happy to say that I was able to write a book about my experience, and in 2015 I was able to get it published.
Wow,
and
congratulations.
It helped me to deal with the problems that I was facing. Mm-hmm. And I would encourage anyone who has any type of problem, not just that with the heart, start journaling and start doing research so you'll know what you're facing. And now I can go to sleep at night.
Well, good. And Ms. Jeanne, what about you?
It affected me in a very different way. Number one, I've realized as the older I've gotten, God humbles us. And this was a humbling experience because I thought I was covering all the bases, so I should not have this. It also made me very, very thankful that I did go get it checked out, that I got these unusual sensations. I can never say that it was pain. I can never say that it was even anything specific other than, the slight tightening in my chest. I got it checked out. And I thought, okay, God gave me a big mouth for a reason. I need to help people with this. So why are you saying yes?
I wasn't agreeing.
So I asked the doctors, I said, I lucked out. I have no heart damage. I lucked out. What should I tell people when they ask me? And they said, recommend that they get a calcium score. If they're going to only do one test, recommend they do that. It's non-invasive. It's very good. And so fortunately, I think I got a lot of people, my friends at least, to go and have this done. And sisters and brothers of mine, and they didn't have anything. They turned out to be a lot cleaner than I had been. So I guess I'm just an advocate for it now, where I didn't think that I had anything to do with it before.
Mm-hmm. And talking about both of your symptoms, some of them were same, some were different, but ultimately both of you knew something was wrong, correct? Okay, and that's when you got checked out, and okay, just wanted to make sure, but you know that something's wrong to get checked out.
You just don't know what sometimes.
Right.
But
Right. Well, that's the scary part too. I mean,
And
we
with
don't
me,
know.
it's
Keep
just
after it if you-
something different and unusual.
Well, you know, it's. I think one of the important things to realize, I think, in all of us is that, and my patients have heard me say this over and over again. You only die in 3 ways. You die of heart disease, you die of cancer, or you run over by a bus. That's the only 3 ways you literally leave this earth.
Wow.
Okay. And so I think at the end of the day, you know, heart disease still is the leading killer of Americans, or in the civilized world. And so I think it's important to realize that, you know, as we get older and we start to grab our jaw, or we start to grab our chest, or we start to grab our shoulder, and we have the denials that, nah, this can't be it. There's a really good chance that yes, it is. And I think that's the realization of it.
I want to ask you your opinion on taking a baby aspirin every day as a prevention.
You know, and aspirin's a funny thing because my wife asked me, you know, and she's one of those people with a very high, good cholesterol and no hypertension and will live forever. But, you know, should I take aspirin? And my retort is with her, would you give your aspirin to your daughter? 20-year-old healthy person. She says, no. And I said, why? She said, well, she doesn't have anything wrong with it. I said, exactly. And so it's really important to look at the individual. And so somebody with blood pressure, yes. Somebody with cholesterol, yes. Somebody who has diabetes, absolutely. And so the more factors you add on, the more important it is for you to take a baby aspirin a day. You know, there is a downside, and so aspirin does cause bleeding, and so that's where the coated aspirin gives you a benefit to it. But there is a benefit, and you had mentioned, you know, you took aspirin before, and that was probably your saving grace. You know, the other thing is if you're having a heart attack, the 2 chewable adult aspirin, the big, you know, 325 that tastes nasty, and you chew them, is what you'll get in the ER. I mean, there is probably some benefit to that in some way, shape, or form, and maybe literally saving your life. So aspirin is important. It absolutely is. It is basically a bedrock in cardiology.
Now, Dr. Fail, you stated previously that maintaining good nutrition is good for a healthy heart. Can women still indulge in a glass of wine or alcohol occasionally?
Occasionally, occasionally. So the party line in the ACC and the American Heart Association is if you don't drink, don't start. If you do drink, preferred wine. And there is a J curve, and so too much wine is bad for you. If you look at the French paradox where the wine issue has been risen, or what it comes from, is that wine is beneficial because if you look at the French, they have much worse diet, they have much less heart disease, but they have much higher cirrhosis. And so there is this where wine is beneficial. It does raise your HDL somewhat. I would not take wine over statin. But I do think that women can absolutely indulge in wine.
Now, what about
occasionally?
What about chocolate? It has gotten a lot of media coverage lately for its health benefits.
Dark chocolate is actually has some benefit to you, you know, and again, occasionally. And so there is, you can overdose. I mean, I always take a piece of dark chocolate and I convince myself I'm doing good and it's okay for me to do that because it's helping my heart. The third piece of dark chocolate probably is, you know, I've probably gone more than I should, but that third piece tastes just as good as the first. So there is some benefits. I mean, I think all of the things that people talk about to say that there's benefits, I think that there is some minuscule upside. The question is what are you, why are you doing it? What are you trying to prevent? And there's probably no prevention, but there's probably very little downside to it.
Well, unfortunately, that's all the time we have left for this show tonight. Thank you so much, Dr. Fail, Kim, and John, for being with us here tonight and sharing your stories and your information.
Thank you.
Thank you.
And Terrebonne General Medical Center offers comprehensive health programs designed to keep the women in our community and their families healthy throughout their life. Learn more at tgmc.com. Up next is TGMC to Your Health with Stan Grava. Stay tuned. Good night.